So before we get started, I do want to just kind of give a quick intro of Aspirion for those of you who might be unfamiliar with us. We are a technology leader in revenue cycle management. We're using cutting edge AI to help hospitals and health systems capture the revenue that they've earned. We are high trust certified. We have a full US based team of attorneys, clinicians, and AI engineers. And this combination of deep industry experience helps us optimize our smart automation to deliver the real results that you guys deserve. And we're proud to share that we've been best in class for denials management for the last 2 years. So just have a great team. I just wanted to share a little bit about Aspirion, but most importantly, why we're all here today is we're covering the zero balance review, the hidden revenue, and it's one of those areas where significant dollars can slip through the cracks, and we're here to help you identify those opportunities. So with that being said, I'm pleased to introduce our presenter, Sabrina. Sabrina Billon is our Senior Manager of Zero Balance Review here at Aspirion. She brings tremendous experience to the topic, and I know you're going to get a lot of value from today's session. So I'm going to pass it over, and Sabrina, the floor is yours.
Thank you, Andrew. It's really exciting to be here. My name is Sabrina, and I've been working in the healthcare revenue cycle, specifically within the zero balance space, for over 10 years. I originally built my experience within the Oregon market and have since expanded into supporting organizations nationwide, partnering closely with clients to drive underpayment recovery and operational excellence. During today's discussion, we are going to dive into the importance of zero balance reviews for healthcare organizations, an area I'm truly passionate about. We'll explore the role that technology plays in this space, the opportunities it creates, and why zero balance work remains a really critical part of the revenue cycle. This webinar is going to focus on key fundamentals of zero balance reviews, common mistakes to avoid, and then how we can utilize a zero balance review to then strengthen payer accountability. First, I want to define what a zero balance review is. Zero balance claims are those claims that you think that you are done with. The payer has made a payment that appears to match expectations, or your internal team has exhausted efforts to recover. What I'm here to emphasize today is that even when a payer shows no denials and internal systems reflect no variance, an underpayment can still exist beneath the surface. Fundamentally, and as you could read here, a zero balance review is a retrospective evaluation of claims with zero insurance balance to confirm that providers received the correct reimbursement. But this work is really exciting because it combines analytics across pricing and auditing, specialized underpayment research, including contractor review and stakeholder communication, and ultimately the appeal and the recovery of that revenue that would have otherwise remained uncollected. Now that we know that this opportunity exists, I want to talk about the key benefits of that zero balance review. First, zero balance reviews uncover and recover revenue that would otherwise remain unrecognized, ensuring that providers are fully paid for the care that they deliver. Second, whether you perform this work internally or partner with a specialized vendor, the intelligence gained really has a lasting impact. These insights can strengthen internal processes, inform operational improvements, and support stronger payer negotiations moving forward. Alrighty, we've gone over the fundamentals of zero balance and some key benefits. Now we're going to jump into the bulk of what this webinar is, and that's really focusing on key mistakes to avoid when approaching a zero balance review. By walking through these common mistakes, we'll also be highlighting practical strategies you can implement to ensure you're capturing the full financial and operational benefits within your own organization. These mistakes we're going to go over are the following 6 mistakes. Number 1 is dismissing those small dollar opportunities. Number 2, failure to address root causes. Number 3, limited scope of review. Number 4, over-reliance of expected reimbursement calculators. Number 5, insufficient resource allocation. And finally, to round it out, the absence of payer accountability. All right, jumping right into mistake number 1, dismissing small dollar opportunities. So here is the mindset of it's just not worth the time or resources to dig into these smaller variances, or we'll just adjust them off because they're low dollar or aging. But here's what we want to discuss today. And what that is that approach can be costly. Even small underpayments can reveal meaningful payer trends. When they are ignored, you risk missing patterns that lead to larger revenue leakage and operational disorganization over time. Instead, a more strategic approach allows you to learn from those small dollar opportunities and manage them efficiently. You can see on the screen, we've listed the right approach, which is truly a tried and true method to approach zero balance review while really honing in on the small dollar opportunities. That approach includes tracking all underpayments, regardless of size, using data analytics to identify those patterns in those areas that are worth review or to put as a high priority of review, addressing the systematic issues driving repeated small underpayments, and then leveraging bulk resolution strategies when appropriate to really save the time and focus on efficiency as well as time to dollars. This ensures that you're not only recovering money, but you're also strengthening processes, gathering those insights, and then holding payers accountable in the long term. As you can see here through the pie chart on the right, 47% of our total recoveries, and this is across our nationwide client base, comes from claims that are under $2,500. These are often the more straightforward identifications, frequently tied to things like contract amendments, system updates, and policy changes. And while a single claim may look insignificant on its own, together these dollars add up quickly and can represent a significant portion of missed revenue. Beyond the financial impact, these findings help inform internal processes. So whether a zero balance program is already in place or still being explored, consider this a reminder to do not look those small dollar claims. They can reveal underpayment trends, service coding or documentation gaps, and support proactive process adjustments to prevent that leakage down the road. A key example of this, and where I've really spent a lot of time supporting our clients, is ED releveling. While tackling $400 to $500 underpayments between an ED level between level 5 to level 4 downgrade may not be tipping the scales financially, pricing and tracking these dollars, which is a huge part of a zero balance review, as well as putting focus groups into place to improve coding, can really ensure that these large underpayment issues are being focused on and can be cleared moving forward. So while it may not make sense to send an appeal for absolutely every underpayment, for every denial, it does absolutely make sense to track those dollars to inform which people need to be put into place for those focus groups to be working together to improve the financial health of the organization down the line. Another great example of how small dollars really adds up come from a common underpayment issue we see, rate effective issues. For one of our smaller standalone hospital clients, reimbursement for a managed Medicare plan increased by 3% in 2025. CMS guidelines say reimbursement should be based on the discharge date, but this payer processed claims based on admission. That meant every claim spanning the calendar year was underpaid on average by about $500. At first glance, that only totaled around $20,000 for that payer. However, when we looked at similar increases across other plans using that data analytics and modeling approach, we identified a total of $200,000 in underpayments with that same rate effective issue. This shows why it's important to balance those high dollar claims that might fall through reporting cracks with smaller systematic issues such as this one. These small dollar opportunities not only add up quickly, but they also create quick wins for process improvements and can help educate teams to prevent that further leakage. All right, moving on to mistake number 2, and that is failure to address root causes. Root cause analysis is actually one of my favorite parts of zero balance review. It's where you're able to put on your investigative research hat, dig into the data, and collaborate with multiple stakeholders to figure out what's truly driving the underpayment. And then on top of that, you can determine how to recover it. There's a real sense of satisfaction when that payment is finally recovered. Often it comes with educating the payer, building that subject matter expertise, and then creating opportunities to share those insights with internal teams, or if you're a vendor, your clients. The key point here is this: simply recovering underpayments without understanding why they occurred in the first place perpetuates the revenue loss cycle. Addressing the root cause ensures that the same mistakes don't keep happening and strengthens both the financial performance and operational processes within the organization. Another really fun part of root cause analysis is developing targeted process improvements. Here on the screen, you can see a table showing our total underpayment identifications over a service date range period. This table, these underpayments are broken out by specific root causes. By tracking this information, we can pinpoint the reasoning behind underpayments and then divide and conquer when it comes to process improvements. For example, in the case I just shared about the rate effective issue, our team was able to bulk process these underpayments using a spreadsheet while working directly with the provider representatives. So that's really taking that strategic approach to small dollars by using a spreadsheet, working directly with a representative, avoiding appeals for every single underpayment. At the same time, while we were working these, we categorized these issues by their root cause. So not just their overall issue that it was underpaid per fee schedule, but really diving in on how we could potentially create a process improvement or recommendation in order for these dollars to be received upfront for future calendar years. We categorize these issues as payment process errors versus perhaps not paid to Pricer, not paid to CMS, which help drive conversations on plugging gaps moving forward. In this particular instance, the payer simply needed to update their internal processing system to process the claims based on discharge rather than admit. It's a very straightforward fix, but immediately turned into additional revenue for the next client year. This shows how root cause analysis isn't just about the recovery, it's about creating smarter long-term solutions that prevent the same revenue from slipping through the cracks again. And it also combines that analytical approach and that investigative research lens on how to recover these dollars, but then how to also approach it so that we're creating systems and processes in place for future revenue gain. Alrighty, let's move on to mistake number 3, and that is limited scope reviews. A common pitfall we see is when hospitals limit their reviews to only certain payers or certain claim types. And while that feels manageable, it often means leaving a significant amount of recoverable revenue untouched. So what does a right approach look like to scope? We believe that the most effective strategy is to model all claims data against contract terms, not just selected segments. For example, what is paid to a DRG methodology versus OPPS. This gives you a holistic yet still very targeted approach view where opportunities exist. Right from the modeling stage, you can spot issues like new rates not being applied. And from there, you can zero in on claims with the lowest reimbursement, regardless of charges, and that can help you resurface contract areas that may not be programmed correctly, like case rates, outliers, or other pass-through payments. Taking this analytical full population approach helps strike that balance between high and low dollar reviews, ensuring consistent identifications, and then ultimately those productive payer conversations. Let's take a look at this chart. It provides another view of that nationwide client base and shows where we're finding revenue by overarching issue types. There are several categories here, and the key takeaway being that our zero balance reviews goes well beyond traditional denial reviews. As you can see in the pie chart, the largest portion, 54%, does come from that unknown or underworked denials. However, it's followed by other categories. It does dip to 13% below. However, this really does show that the zero balance opportunity is across multiple issues, and each category represents an opportunity to recover revenue, and those dollars can add up quickly. One initiative approach we've implemented here is leveraging AI to pull medical records and process high volumes of denials faster. This allows our teams to continuously focus on those underpayment issues, what's truly driving those variances versus those denials. After all, once one gap is closed, another one inevitably appears because we are consistently negotiating contracts, updating rates, and to meet policy, payer changes, and just the overarching, ever-changing landscape of healthcare. Investing in technology to tackle the largest piece of the pie has really allowed us to reallocate our resources, free up some time to address all issue types that truly impact revenue and strengthen payer negotiations. Alrighty, this really ties in, that previous slide ties into mistake number 4, which is one that we see pretty consistently, and that is the over-reliance on expected reimbursement calculators. Many organizations use this tool to estimate expected reimbursement, which is a smart practice. The mistake, however, is treating the calculator's output as the final answer rather than using it as a starting point for contract validation. We've written out here a right approach, which again is a truly tried and true method that helps us really stand out as a zero balance review experts. First, we use technology, but we do not rely on it blindly. We still ensure that our individuals can review contracts, price claims, and make those critical determinations and for themselves whether or not an underpayment is in fact underpaid, because we all know that if I price a claim to a contract, I'm still gonna get pushback from a payer if I simply just say, this is not paid to contract. There could be anything related to policy, payer, provider manuals, etc., that is really driving the underpayment. So only relying on those pricers to then feed into appeals without that critical thinking aspect in the middle can really down the line create additional administrative burden for your teams rather than focusing on the truly recoverable dollars. So we use that technology, but we don't rely on it blindly. Second, The right approach is to validate those calculator results against your own actual contract terms. A lot of a lot of what's missed within those expected reimbursement calculators is the language within the contract that is just impossible to add in to those contract pricers. So really taking a fine-tooth comb and looking at the reductions or the limitations or the exclusions that's hidden deep within the language of the contracts really helps identify whether or not your pricer is potentially not capturing a revenue lift. And third, maintain a detailed library of unique payer requirements and policies so you know when something doesn't look right. Payers are consistently changing their billing policies. And so or authorization policies or really anything. So really having that consistent review, whether that's bi-yearly or yearly, to then stack it up against the expected calculators can really help determine whether or not the claim is truly priced correctly. So while having expected calculators is useful, ensuring that team members can still interpret contracts and price allowables is really critical to leveraging it appropriately. And this is where AI technology is really opening up an exciting new possibility. Similar to how I've mentioned, we've leveraged AI to pull medical records and generate appeals to really help us dive into that ever-growing denials piece of the pie. Aspirion has identified a new opportunity with AI-driven contract modeling. The technology can parse entire payer-provider contracts and addendums. It can extract key information such as covered facilities, term dates, plan names, and fee schedules. It converts complex, unstructured contract language, which is what I was describing earlier, into structured databases of rules and rate tables that can be applied directly to claims pricing. So not only can it interpret contract, it can then be utilized to feed directly into claims pricing, cutting out a lot of middleman that administrative burden work. For claims pricing, AI calculates the expected reimbursement across both government and commercial payers. This includes commercial payers with those model contracts, as well as Medicare and Medicaid fee schedules that are, as we know, taken from so many different resources. The model can differentiate between a Medicare DRG payment, a commercial per diem rate, or an outpatient APC or case rate. At Aspirion, our AI is built to continuously monitor expected versus calculate actual reimbursements across all contracts. This is flagging those discrepancies in real time, even before the accounts close. By learning from historical data, contract terms, and real payer behavior, it improves predictive accuracy over time, helping us proactively catch those underpayments and close those revenue gaps faster. The real value of AI, which we have seen, is scale. Let's take a look at this chart. The first half of it shows the placement to first appeal, the days from placement to first appeal, and the bottom half shows the days from placement to closure. Before AI, our manual appeals took 70 days from claim placement to submission. However, since we've invested in AI, we have reduced this to 32 days, which is resulting in a 2 times faster review. Resolution times have improved as well, going from 219 days down to 158, which is about 1.4 times faster. By combing through every claim and assisting with appeals, AI allows us to process entire volumes of data with the same resources, while ensuring nothing is left on the table. And as you evaluate your zero balance revenue cycle strategy, this is the type of technology-enabled approach that can address common mistakes, turning contract and pricing complexity into a true advantage. Another real great thing about it that I wanted to mention is just it really prevents burnout from the folks that are truly driving the appeals research, that contract research, that appeals driving the submissions and recoveries, because all of that still remains the same. However, what we can reduce is the administrative burden to determine what truly is worth pursuing and what is potentially okay as paid. And that leads us quite well to mistake number 5, which is insufficient resource allocation. Resources have always been a challenge in revenue cycle management, and they always will be. But that's why allocating them incorrectly can lead to pretty costly mistakes down the line. Think of it this way. You need the right resources in the right places at the right time. Let me show you how our approach looks, and we have it here listed. As I mentioned earlier, we leverage AI heavily, but it's critical to have a human in the loop at every stage. Technology is powerful, but expert oversight ensures accuracy, strategic thinking, and proper follow-up. The right approach includes assigning those qualified revenue cycle experts at every turn, still, like I mentioned before, still maintaining that ability to interpret complex payer contracts. And then putting a large focus on maintaining dedicated focus on appeals and follow-up. So still ensuring that all of these technology aspects are helping to work for those appeal specialists, those claims follow-up representatives, in order for them to be able to do their job more efficiently, quicker, prevent burnout, etc. And then finally, utilizing all of the intelligence that we've gained from every aspect of that technology piece to focus on efficient reporting, key identifications, what's really going to be useful for the financial health of the organization. And then wrapping that up to provide strategic recommendations to continuously improve those processes moving forward. Here's another visual to really hammer down what allocating the right resources may look like. While we have that proprietary AI to model the data and help drive those appeal submissions, like I mentioned earlier, we really, the right approach is to really disseminate out the different skills so that people are in the right place doing the right things at the right time. Attorneys can help escalate complex claims and denials, putting appropriate pressure on payers so those claims do not have to live in the follow-up cycle for some of the long follow-up periods that we're seeing over 150, 200 days. So really utilizing a legal bench to help escalate those issues and take it out of the claims specialists workday has been really incredibly helpful. Clinical specialists provide the on-the-ground expertise to guide our coding recommendations to what changes are truly feasible. So that really helps have that extra support where our claims specialists can really go to in order to help make the decision on if this claim is worth pursuing to escalate, to recode, to resubmit, etc. Claims specialists are the individuals who are auditing the claims, identifying the underpayments, and then the ones also recovering those dollars. So our claims analysts, there's multiple roles here. We have our auditors, our analysts that are pricing data from the highest level, because while AI can really help us model and ensure that every claim is being modeled, we still need those auditors to disseminate what is truly worth pursuing, to make sure that we're using audit strategy, that we're looking at the lowest reimbursement, the highest charges. We're looking at new payers that have entered the mix since we last looked at the data, and can really take what is being provided by AI, really stack it up what we're seeing within the EHR system to help determine where we can recover those lost dollars. We also have our follow-up representatives that are part of those claims specialists that are the ones really building the relationships with our payers. We know that payers consistently change their path with how to even appeal denials and their timeframes to adjustments. So having our follow-up representatives be able to work, follow up on claims that are truly priced correctly and truly underpaid from the get-go really helps us be able to utilize their insights on payer behavior that we can then take back and really take that intelligence and utilize it for our payer relationships. Finally, we have our AI engineers that are continuously feeding and refining the AI models to improve accuracy and efficiency. And the key here is that at every point of the way that intelligence is being shared, communicated, so that all of these different folks and resources are communicating together so that we can continuously improve the AI that is helping us do our jobs easier and helping us to reduce some of that admin error that has historically, burdened us and impacted the bottom line financials. We know this approach works, and if you're thinking about adding an AI component to your revenue cycle strategy, it's critical to have humans in the loop to validate findings, guide strategies, and ensure nothing is overlooked. Finally, let's move on to mistake number 6. This is absence of payer accountability. If you implement a zero balance review and avoid the mistakes that we've discussed throughout this webinar, chances are you now have a wealth of data and intelligence at your fingertips to apply pressure on payers. While there are obviously limits to what can be achieved with payer accountability, implementing efficient tracking and reporting and finding a system to pull that data easily can significantly strengthen your position. Having this structured approach allows you to follow up effectively, escalate issues when needed, and ultimately ensure payers are held accountable for accurate and timely reimbursement. We have a right approach here as well, and that's really to quantify underpayments, even if they do not overturn for additional payment. That's a really important aspect of zero balance review, because those are the true dollars that can help drive that payer accountability and conversation. Escalate aging appeals to ensure timely resolution. So while we're very successful to get single appeals overturned, coupling that with escalation processes can really double our success rate. So not losing sight of that individual follow-up on a bi-weekly, monthly basis, but also utilizing either our clients' escalation lists or our relationships with provider representatives. We can escalate aging appeals and really ensure that our accounts are being reviewed by multiple angles. And then again, we can utilize those turnaround times of our escalation sheets to drive that payer conversation down the line. And then we have the third aspect of this right approach of payer accountability is presenting claims performance as evidence in payer negotiations. So like I mentioned before, having all of that data and then taking the time and the investment on what is going to be useful, what is truly payer-driven error or behavior, and figuring out a way to pull that easily and present it to meetings really helps the conversation and the negotiation period down the line. I've mentioned a lot about finding that right reporting, that time efficient way to really wrap up all the data in a very digestible manner. We wanted to show some examples of the reporting that we provide and that you can implement on your own. This type of reporting is critical because it serves as backup evidence when negotiating with payers. You need to also be able to show numerically what happened in the past to strengthen your position. The first chart shows the total AR reviewed across specific service dates, along with the underpayments that were identified through that review. So with those two key metrics tracked, we're able to help calculate an overall underpayment rate. Beyond that, we have our total collections from that underpayment that's identified. So that really helps determine what the current recovery rate to help see how we can continuously improve upon that figure. And then, like I mentioned before, tracking the efforts that are exhausted and really even tracking why those efforts have been exhausted. So that's the reasoning behind that can really help then pull, what the payers are being the most difficult to work with, for example. The second chart that is overlaid here is our underpayments by issue. These allow you to really distinguish between provider-specific issues versus payer-specific issues. This ensures that you're presenting accurate, actionable data to the payers. And so you're cutting down that opportunity for them to say, oh, well, this is provider error because. So really differentiating your issue types, your root causes by what's preventable and what is truly payer error, and then pulling the data that's truly payer error can support that conversation. And then finally, another view here we have is the underpayments by payer. And this is more self-explanatory how it can truly help payer conversations, negotiations, etc., by the dollars that are either still remaining that are underpaid. All right, so that concludes the 6 mistakes portion of this webinar. We just talked about 6 mistakes that we recommend that you avoid while implementing a zero balance strategy into your revenue cycle operations. And within each mistake, we went over strategies that can in turn really ensure that you are putting efforts in the right places and setting yourself up for success. I wanted to close with a real world example from one of our clients. This is a non-profit health system that had been working with a different vendor, making some costly mistakes. They were bleeding revenue from closed accounts, and they were just dismissing small dollar claims. They were doing limited scope reviews, like we mentioned previously, and they were not capturing all the revenue that was there. Here's where it gets interesting. They missed the opportunity to track these process errors, and therefore root causes were not addressed at all. Stop loss cases were skipped because they relied too heavily on automated calculators. And then those documentation gaps were missed because they were not utilizing their people on the ground efficiently to help our appeals specialists make those determinations. And that led to misdiagnoses, miscoding opportunities, and therefore lost revenue. And then incorrect modifiers affected reimbursement because payers were not being held accountable to their updated policies that we did not get information on. So knowing that, coming in as a secondary vendor and seeing all of these errors by truly just diving into the claims data with that right approach that we've mentioned several times before, really helped us to recover the small dollar claims, not just the obvious ones. We're able to perform comprehensive full scope reviews, taking that analytical approach, ensuring that we model all of the claims data, but balancing that small dollar review with that high dollar quick in the door recoveries. But At every point, we dug into the root causes to prevent those repeated errors, and we provided that client recommendation throughout our reporting. And then ultimately, we are able to hold payers accountable to ensure accurate reimbursement utilizing the legal bench as well. So the results speak for themselves. And from the same claims pool that the previous vendor had reviewed, we were able to recover $1.8 million, which is 180% more than that previous vendor found. So with that, that's the conclusion of the webinar. And I really hope from today's presentation that you've learned that a zero balance review is not only worth your time, but it can also be rewarding and even fun. There's a systematic way to approach it, and yet it's another tool to help boost your revenue. So thank you so much.